Without more COVID relief, our nation's 911 emergency medical system will collapse. That's the message from the Ambulance Association. In a letter to the Department of Health and Human Services, the association wrote that ambulance companies across the country are at their breaking point now. An HHS spokesperson says the agency gave them another $20 billion in aid last month. But EMS services warn it's still not enough to keep them afloat. NBC's Ellison Barber live in Jamestown, North Dakota. Ellison, what happens if some of these companies just go under?
Well, Shepard, you could call 911 and ask for an ambulance and not get it, or you could wait an exceptionally long time for one to arrive. This right here is the only ambulance service in Jamestown, North Dakota. They have a total of 4 ambulances. They say right now, not only are they running far more calls than normal, the majority of them for COVID-19, they also say they are having to make a lot more frequent trips further and further away. Listen here.
Now we've gotten to a point where hospitals are filling up in smaller areas, and we need to transfer these patients out to larger areas, not necessarily because they need a higher level of care or a higher level capacity hospital. They just need a bed with the same level of care that they would reach here. We just don't have the room for them. So there's times when we're taking 2 COVID patients at one time, very long distance across the state.
At one point today, 3 of the Jamestown area ambulances were out on calls, and 2 out of 3 were on COVID calls. One crew spent at least 5 hours transferring a COVID patient who was on a ventilator from one of the smaller hospitals here to a bigger one about 100 miles away in Fargo. The thing about ambulance service is that the majority of states do not list them as essential like they list fire or police. North Dakota is one of many states that does not deem ambulance services as essential. And the paramedics we've spoken to, they tell us that even before the pandemic, it made it really hard for them to get any sort of federal funding and sometimes even state funding. Now, when you add a pandemic on top of that, they say it's causing a lot of problems, and not just pushing rural ambulance services to the brink, but for many of those very small rural services, they're already past their breaking point. This ambulance service we've been with the last day and a half, they got a little bit of federal aid back in April, but since then, Shepard, they haven't gotten anything.
Ellison Barber, thank you.
Shepard Smith here. Thanks for watching CNBC on YouTube.